Bengaluru being a metropolitan city, we have women from the north of India, south of India with different cuisines, and their relatives telling them maybe in the north to have more of rotis, in the south to have more of rice. And we obstetricians may be telling them to have more of proteins rather than carbohydrate, not complex, not simple carbohydrate, but complex carbohydrate. The diet in pregnancy becomes so difficult. How do we help our patients?
But Dr. Puri, this is the most important question. Never they will miss asking us about what can she eat, what can she not eat, and can she do this? And this is their priority. And it should ideally be the priority for the doctors also. That's why the FIGO is telling guys, think nutrition first, because that is the most important aspect of the care in the pregnancy that we ought to give. But I agree that, there is a complex mix of the kind of advice that we give and what the patient can relate to, because the cuisines are different, the likes and dislikes are different, and who's going to make it for them, that's another big challenge. And so all put together, I think that again the femtech has come to the rescue, because many who are viewing this program may already be getting on to some apps and some recipes and gather for themselves how much proteins, how much fat, how much carbohydrates, what's in it for them. But specifically, there's a nutrition checklist that we offer the patients both on the digital platform as well as in their in person visits, where what is the kind of food groups that they will take, what proportion, how many times in a week they will take that. If they record that, okay, like a journal keeping, then it brings home the point where the gaps are and what they must be focusing on. So, here again, I would like to say that not only the variety of cuisines, whether it's the rice or the fish or the wheat, they would be able to cook something up from the variety of apps that are available. They'll figure it out for themselves. But this is an extension of our advice, which comes very, very handy for the new mothers and mothers to be, and thereby through them a good nutrition for the entire family. So I think once again we should appreciate the power of Femtech 360 right round the life cycle and life course for just about everybody in the world.
Yes, definitely sounds very useful to all our expectant mothers.